Okay, welcome everyone. I guess we are ready. Okay, so welcome to IUST Alumni Council. Let me briefly introduce what this IUST Alumni Council is about. It's just a bunch of alumni of IUST got together, wanted to have build a common platform for all the stakeholders of IUST. Like there are administrators, there are faculty members, there are students, and there are alumni also who are stakeholders of the university. Wanted to create a common platform for all of them to connect together, to share ideas, so that a feedback loop is created and ultimately results in better governance at the university. So under this IUST Alumni Council, we are planning to hold activities under different themes, and one of those activities is holding panel discussions on different topics, on different pressing issues which the university is facing. So in that regard, this will be our first panel discussion, and the title of this discussion is Role and Responsibilities of Universities in Crisis and Emergencies. So we are already going through a crisis, so I guess this was the time to discuss about it. So let me introduce our guests first. Our guests are, the first of them, Dr. Naveed Nazir Shah. I don't think he needs any introduction. He's a household name these days. Everybody knows him. So I'll briefly go through who Dr. Naveed Nazir Shah is. He's the leading pulmonologist of India, and he's currently working as a professor in Government Medical College, and he also currently heads the Department of Chest Medicine at GMC Srinagar. And more importantly, he is one of the frontline workers against the fight against this COVID-19. And we have with us Dr. Shabir Hassan. Dr. Shabir Hassan has his roots in Kashmir, but he is currently in US. His journey from Kashmir to US has been through Kashmir University. He completed his bachelor's in chemistry, biology, and English from Kashmir University, and then his master's in biotechnology from University of Pune. And he is currently a research scientist at Harvard Medical School in the US. And more importantly, he has been an overseas mentor for a low-cost ventilator prototype project, which was carried out at Design Innovation Center, Islamic University of Science and Technology. Then we have with us Dr. Shahkar Ahmad Nahvi. Dr. Shahkar Ahmad Nahvi, he is currently working as an assistant professor in Electrical Engineering Department at Islamic University of Science and Technology. And apart from that, he is also serving as coordinator, Design Innovation Center, Islamic University of Science and Technology. Design Innovation Center, what is it about? We'll come to that later. And what it has been doing for the last couple of months, we'll come to that later. And finally, we have Mr. Asif Shah. I would like to introduce Mr. Asif Shah as an alumni of Islamic University of Science and Technology. He graduated from the university in 2016 with an engineering degree in electronics and communication. And I know him from his undergraduate days. He was a very passionate student. He developed skills regarding product design and development, carried on his interests, and finally went on to founded a startup which goes by the name of Symcore Technologies in 2019. And in this startup, they mainly deal in the domain of industrial electronics, medical electronics, Internet of Things. They deal with product design and development there. So with this introduction, I guess we should start our discussion. Over to my friend, Mr. Rais.
I will again welcome all of my guests and Assalamu alaikum to all of you. So as
Right.
Asim already introduced the topic for tonight's discussion. So in that backdrop, it's basically human nature, and this exhibits both at individual level as well as the societal level that threats bring the extreme out of us. And this phenomenon has been observed repeatedly throughout the history. In the recent history, the world was brought some of the greatest advancements in all of science, in all the branches of science, ranging from science to communications. Perhaps the best example is that of Alan Turing, who uh, it would be safer to say that he single-handedly won the World War or saved the Europe for the British. That he intercepted the codes and helped break the codes from the Germans. And a safe estimate is that his contributions basically shortened the war in Europe by about 2 years and helped save 14 million lives. Now, these days also, as all of us are aware of that we are again faced with a pandemic, and the situation is not very easy. And as of this morning, I saw the statistics that 7.27 million people are affected with corona, and 413,000 deaths have been recorded as of this morning. So the situation is particularly complex in underdeveloped countries where the health infrastructure is in tatters. We see the near collapse of healthcare system in cities like Delhi and Mumbai, while at the same time, the strategy of lockdown is also weighing down heavily on the society's most vulnerable. Now, in this backdrop, we have gathered this esteemed panel tonight to understand how we can deal with this situation in particular and other such situations in the future. Specifically, we strive to understand what role the universities, which includes academicians and the support staff from the universities, extend in terms of collaborations and infrastructure, should and could play. What the expectations are, how have we fared so far in this fight, and what should be our next strategy for the future such events. With this thing in mind, I would first turn to Dr. Naveed, and I would like him to share some light what his assessment or what the assessment of the healthcare professionals was when we first went into this pandemic in March, I think, and what his basically I would like him to shed some light what his expectations was of the assessment was of the healthcare system first, and then what his expectations were from the various educational institutions, particularly the universities. So over to Dr. Nim.
Assalamu alaikum.
Welcome.
Assalamu alaikum, everyone. See, when the pandemic started in the China in December, or if you see, our administration was well geared up to tackle the situation. They tried their best to start at the early, even when there were no cases in India. Our administration tried to gear up for in terms of building up the infrastructure in the hospitals and dissemination of information regarding the disease, the preventive measures. So we started quite early at that time. But if you see the magnitude of the disease we are having right now or all over the world, the best of the healthcare systems in the United States, Italy, which are considered as the best in the world, even they could not cope up with the crisis in terms of manpower, in terms of infrastructure. So we were even way far behind. And if we had, God forbid, such magnitude of disease, no healthcare facility in our place is going to cater to the magnitude of the number of patients or maybe the severity of the disease. So I think most important, since we started early, we had a lockdown. Lockdown was also in my assessment, it was a building measure for the infrastructure building up in terms of health and dissemination of information to the people, and teach them about how to prevent the disease, because we know we are not having any treatment of the disease, we are not having any vaccination for the disease, so we have to more rely on the preventive measures. So I think lockdown was also a part of that only. But in terms of how the universities could help us in this, see, I am really appreciative of the Islamic University, first of all, who took the initiative. Mr. Jawad and Mr. Shahkar were a part of that, in regular touch with them. They got some innovative things. The face shields, I think, was the first of them on which they worked on and supplied to different hospitals, which was a great contributing factor at that time, because there was shortage of these face shields, masks, and all that. So that was an innovative. Then I think they started to work on ventilators also, although fortunately our patients are tolerating the disease well, and less number of patients are having need of ventilation right now. But in terms of need, they have, I think, prepared a good infrastructure where we can if they are needed at all. Third, I'm also having an experience. I gave them an idea of preparing those negative pressure chambers for the beds, because if you see right now in Kashmir, we are having ICUs at a few places, and the ICUs which we are having don't have negative pressure rooms. So the healthcare workers, they are at risk of contracting this deadly infection. So I give Oh, sorry, I got disconnected. So I gave them the basic which whatever I had, the approved source, and they worked on it and have been, I think, able to prototype of the same. So they have right now. I'm in quarantine also, so I don't have the information right now where they have managed to put it in place right now. And third most important thing is that since this is an educational institution, dissemination of information and ensuring that the right information goes to the students, different masses, and ensure compliance of that the health and the administrative advisories. That can be a good thing which can be disseminated properly by the university authorities, by the students, by the teachers of the university.
Thank you, Dr. Naveed, for taking us through what your expectations were and what you saw in the last couple of months. I would like to turn to Dr. Shahkar Ahmad Nahvi. Okay, Dr. Shahkar, I would like to draw the attention of our viewers to the fact that, like Dr. Naveed and other medical and paramedical staff, they have been on the front line of this battle against this pandemic. There is a back-end team also which is working on different projects which would help us fight this pandemic effectively. And in my opinion, in our valley, one of the prominent back-end fights against this pandemic is fought at Design Innovation Center, IUST. Since you are the coordinator of Design Innovation Center, Islamic University of Science and Technology, can you briefly take us through the development which has taken place as a response to this pandemic at DIC IUST in the last couple of months or so, starting from when the face shields were first developed and right to the current project, the negative pressure beds, which you are currently working on. Dr. Shahkar.
Thank you very much. It's a pleasure to be on this panel and to talk to all of you there. There are two things actually. Design Innovation Center had the material infrastructure to help the people in the valley to some extent. And the other and the more important thing was that the Design Innovation Center had a team, a human resource team, which was there to put the things together. And the team was actually the students who had already worked there for a lot of time. So we started with face shields. That was in March, just after the lockdown was announced. It was Jawaz who came up with the idea. So Jawaz is actually an employee of the Design Innovation Center. So he came up with the idea. He's a design fellow there. he sent it to me by email. I just realized the spark in the idea. I saw that yes, this was something which could be assembled very quickly with locally available materials, and this was something that was actually needed by doctors. So I just pushed the idea through. I sent an email to Dr. Naveed. I sent an email to many. I have some friends in the medical community. I sent them photographs, and it was immediately picked up, and it was the Javas started getting huge orders, and the doctors, they really liked it, and they felt that it was something that was helpful to them, especially while doing any medical procedure which caused aerosols to come out of the patient, right? So Alhamdulillah, till now, Jawaz has made around more than 900 to 1,000 these face shields, and they have been distributed throughout the valley, Kupwara, Hadwara, Pulwama, all those places. He has all the details. We did not have material infrastructure for it. After some time, we could not manage to get all the required stationery and other things which were required for it. And then we got in touch with Abdul Hamid Saab of Rahim Motors, and he has some connections with an organization called Atsut, which provides for the poor and the needy in the valley. So because of that connection, Abdul Hamid Saab arranged raw material, and that raw material reached Jawazom, and he was able to do this much work. So it is basically a collection of a number of people's efforts. Jawaz's idea, material supply by Atsut and Abdul Rahim Saab, and a little encouragement from my side, right? The second project, that was the ventilator design, low cost frugal ventilator design. Also, it was something that did not actually come from me. It was basically an initiative largely of Dr. Shabir Hassan, who is on the panel. He tried to push it through. He made a call to the vice chancellor. He made a call to many other people, and then there was also this huge WhatsApp groups, many of them, which were clamoring for a ventilator to be made in the valley. So I was not part of those groups. Also, I'm not very involved as far as the social media is concerned. But through some means or the other, pressure started building upon me also, right? So many of the members of the teams who finally worked on the ventilator were part of those groups. So that pressure and the pressure from Shabir Saab, Vice Chancellor Saab, and others. So I finally, kind of bulged in. I said, okay, fine, let's go and let's try to make this thing. And Alhamdulillah, we were able to do and demonstrate something to an extent within 10 to 15 days, 15 to 20 days of starting the project. I also took some inputs from Dr. Naveed. And after that, we took that ventilator to hospitals. We invited doctors there. A number of people have seen it, and we're still working on it. Although, as Dr. Naveed said, the requirement for the ventilator is not that much in the valley right now. But at least we could at least do something. So there's some degree of satisfaction as far as that is concerned. We also made splitters. So splitters, as you must be knowing, is something that you connect to the ventilator. It's a 3D printed thing. It's a controversial device, but in any case, it could be used in case of dire emergencies. So this was also some people from the civil society who came to know that the IC had 3D printers, and they contacted me, and they said, we have these designs, can you print them? I said, okay, fine, we'll print them. So we had the infrastructure, we had the people who could do it, and then Jawaz also went to schemes. He customized the splitters for the schemes people, and then we had our own designs. We printed those designs, two kinds of splitters, ventilator splitters, and oxygen supply splitters. And the last project that we're currently doing, and we have been successful to some extent in actually demonstrating that it can be built in the valley, is negative pressure chambers. This is also Dr. Naveed's initiative. He called me up. He sent me some photographs. He said, "Can you build this there?" I did some research. Jawaz did some research, and then we came to the conclusion that this is not something very difficult. It is possible. And a team of doctors sent by Dr. Naveed a couple of days back visited and they saw it, and they were satisfied with the working of the project. So I would like to end this up by saying that it is more of the human infrastructure that has been built around DIC. We have been working in DIC for the last 5 or 6 years, and automatically a team of people has been created, which includes Shoaib, which includes Zulkarnain, who worked on the project, which includes Asif right now, who's on the panel, and a number of other people. So this team is actually the one who has, gotten all the things through. In addition to the lab infrastructure that we have, which is also good, but the human infrastructure and the kind of understanding that we have with each other is something that made us pull pull this thing through. Yeah.
Thank you, Dr. Shahkar. As you correctly pointed out that to get the best things done, more than infrastructure, more than the physical infrastructure, the people, the human resource, that are basically the real backbone of any innovation. So with that, I would like to turn to Dr. Shabir Hassan, and I would like to get a perspective from him what the foreign universities are basically doing in this pandemic, how they are responding to this, and maybe what our what inspiration we can draw from there. So, Dr. Shabir.
First of all, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much for initiating this discussion and inviting me over to be a part of this worthy discussion wherein we have really great doctors on the panel, for example, Dr. Naveed, Shah, and some really wonderful innovators in the form of Dr. Shahkar, Nahvi, Asif, Shah, and some people who could not actually join us, Zulkarnain or other members of the team, Rudar. First of all, I would like to actually please forgive me. Is the medium English, or can I switch to Urdu or Kashmiri as well?
We were just about to switch to other languages. You are free to choose language.
Wonderful. So, pehli baat, if we have to first of all look at the role of universities from a perspective of someone who's actually looking at the Western world, चाहे European countries में हो या US में हो, वो सबसे ज़्यादा उसका दारोमदार रहता है इस चीज़ पे कि what is the culture at a university. तो अगर तो वुचो आज ब्रोंट 30 वरी ओस कश्मीरस मंस अक यूनिवर्सिटी बे ओस regional engineering college yimz चीज़ and REC was still a part of Kashmir University. गो यमन दोन यूनिवर्सिटी सिर्फ अक काम 30 वरी ब्रोंट के यम सिर्फ पढ़नावान तो डिग्री दिवान ठीक बे जो भी आपको टेक्निकली स्ट्रांग करना है किसी चीज को ओन करना है टेक्निकल एक्सपर्टीज किसी बंदे को या बंदी को देनी है that depend upon what that person or what that student was pursuing at these two universities, right? तो उस सेंस में 30-40 साल पहले तक ये सिर्फ it was limited to only issuing degrees कि अगर किसी को MA in sociology कहाँ कैसे या Bachelor of Engineering as आज फना BTech, Bachelor of Engineering in Instrument and Technology, या Electronics and Communication, Mechanical Engineering या Civil Engineering तम पद गई काम आज ब्रोंट 20 वरी वन अवस लगभग 20 वरी हतुन स्टार्ट गसन या 20 वरी ब्रोंट हतुन स्टार्ट गसन के लोको लोग पब्लिश ते करन असलन जर्नल मंस I'm ब्रोंट कैसे पब्लिश करन मगर somehow what it created was it started to actually come out in the open on an international level, on a national level. Log samjun ke published hakan karit, log karan kaimi qism research gasan. Meshi yaad insan is bachelor's as karan. Us time pe Kashmir University zoology department. Us time pe biotechnology bhi tha. It was very new. Lekin zoology department, botany department were mainly focused on the research that is actually mainly classical in its sense. So you did not have, for example, people doing genetic engineering, people doing epigenetics. People were mainly doing limnology. Ahmad Wushin malab kunshe etmas go lekas mas gay, jalimas mas gay, type wush kam protozoans she ya kam zoological samples she, botanical samples she, flora fauna gash. US culture. ठीक एम पत अगर इस वन का सब 10 वरी ब्रोंट है उनके से engagements हिकन सबदेन engagements with the public sector, with the industrialists, with the entrepreneurs. So you could actually have different cells. You could have an entrepreneurship cell that was working closely with the management cell, with the law department. Here, तो ये चीज है उनके से वार हिकन सबदेन the time पत on the scene, you had also kind of a boom that was happening all over the world. It was happening already in some other parts of the world, but it now reached, the wave now reached Kashmir. Ahmad Sagar काम के innovation centers आने लगे, ठीक है? For example, DIC जिसकी आप बात कर रहे हैं अभी, जिसको शाकर साहब लीड कर रहे हैं. इसी तरह से NIT की तरफ से है, I think it's called IIED, and there are also some other similar kind of stuff that Kashmir University has started. You have Baba Ghulam Shah Badshah University, you have Jammu University, you have Mata Vaishno Devi University, you have other universities. If we talk about the region J&K, तो उसमें 5-6 universities आती हैं. I think every university actually started to do that. अब ये कल्चर की बात जो है, it will take some time कि आज से 10 साल के बाद जो है लोग, for example, अभी कोविड में अगर IUST and NIT actually started an initiative. They developed a low-cost ventilator. It was a very big news, and rightly so. Why not? Because this was, I think, happening for the first time in Kashmir, and in those conditions, जहाँ पे आपके पास traffic सुविधा available नहीं थी, जहाँ पे आपके पास curfew was already in place because the government did not want people to come out so that they could actually contract the disease. Or इस sense में, इस situation में, when you also were not able to actually get certain components from Delhi, from Pune, from outside India, तो उस sense में आपने कैसे इस चीज को बनाया, कैसे इस चीज को public के सामने रखा, that is a huge task. And I should congratulate the team at DIC for doing a wonderful job. It was not something that you could just see, मैं सुबह से याचू मारिया चीज़ पर, या you should शायद truth की tasks को सोचने के हैं. You could actually see that there were a lot of functions which were already going, and the fact that they had Dr. Naveed Shah on board, who was actually consulting them, कि कौन सी चीजें जरूरत हैं, कौन सी चीजें जरूरी नहीं हैं, किस चीज पे फोकस करना चाहिए. अब आज से 10 साल के बाद, if something like that happens, then it will not be that big a story, right? Because the culture has now got in. तो वो चीज जो है ना, जो कल्चर की मैं बात कर रहा हूँ, it has now started to actually catch up. And inshallah, I hope कि in the near future, कश्मीर में ऐसे सारी यूनिवर्सिटीज जो हैं, J&K डिवीजन में जितनी भी यूनिवर्सिटीज हैं, उन यूनिवर्सिटीज को they will actually try to learn, some kind of a lesson, I would say, or get inspired, I would say, from these kind of initiatives. और जहाँ तक बात यहाँ की है, यहाँ की universities में, I think there are like universities. First of all, we have to understand. It goes back to what I said. Culture की बात है कि we have to understand the actual functions, actual role of university, not just during pandemic, not just during a human emergency, not just during a health emergency. So there are a couple of things. One is that universities' role, of course, apart from education, is research also. Scientific research, engineering research, social research, political science research. दूसरी चीज होती है कि स्टूडेंट्स को भी पढ़ाना है. अगर ऐसी कोई सिचुएशन आ गई जैसे आज हमारे पास है, 3-4 महीने से कोई यूनिवर्सिटी नहीं चल रही है, कश्मीर में तो कई और टाइम से भी नहीं चल रही है, for the last, because of the situation that's known to everyone. उसमें क्या हुआ कि you have to actually take care of the students. You have to finish the courses, right? You have to finish the degrees as well. And at the same time, I see universities as a confluence of people coming from different fields of expertise. You have engineers, you have scientists, you have people who are studying medicine, you have social scientists, people who are actually studying social sciences, you have people who study communication, who study journalism, and you have people coming from the management side. तो ये चीज अगर अब कोई pandemic situation आएगी, यूनिवर्सिटी का ये रोल रहेगा कि it will actually bring all these people together on a single platform. क्योंकि engineering, medicine और research के अलावा you have a huge need on the ground of managing people, managing patients, managing COVID centers, जो भी quarantine centers हैं. तो इसके अलावा I think we need to also learn about the way people deal here. मैंने देखा कि यहाँ पे बहुत सारे ऐसे papers भी आ गए जिन्होंने social science पे actually publish किया. How people actually react, what happens to people during such a lockdown. यहाँ पे मैंने ये भी देखा कि I was a part of an initiative that a local NGO actually started here, जहाँ पे वो बच्चों को दिखा रहे हैं, बच्चों को समझा रहे हैं. A person a kid who is in 9th class, 12th class, 6th class, जिसको नहीं पता कि लॉकडाउन के मीनिंग क्या होते हैं, लॉकडाउन में होता क्या है. So I was brought in, as someone, as a resource person who could actually tell what sort of situation people find themselves in, especially kids. What should they do in a lockdown kind of thing? So उसमें ये चीज समझाई गई कि people can actually do more stuff on the internet, but that's not possible in Kashmir when we have 2G internet. आप इस सिचुएशन में क्या करेंगे बच्चे? इस सिचुएशन में आप यू कैन गो बैक टू बेसिक्स, स्टडी फ्रॉम बुक्स. मेरे कहने का ये मतलब है कि देयर आर अ लॉट ऑफ थिंग्स दैट आर हैपनिंग नॉट जस्ट ओनली फ्रॉम द हेल्थ फ्रंट. देयर आर आल्सो थिंग्स हैपनिंग फ्रॉम सम अदर लेवल. नाउ देयर वाज आल्सो हैकिंग, कोविड-19 हैकिंग, जैसे हैकिंग मेडिसिन है, हैकिंग इंजीनियरिंग है. ये छोटे छोटे इनिशिएटिव्स होते हैं जो कि वीकेंड लॉन्ग होते हैं. एक वीकेंड पे करते हैं, 4-5 बंदे इकट्ठे आते हैं from different. So what happens is that I'm telling it for the sake of our listeners, the viewers who are actually watching us right now. आप लोगों को डेफिनेटली पता होगा कि यहाँ पे इवेंट किए जाते हैं जिनको बोलते हैं हैकिंग इवेंट्स. हैकिंग इवेंट्स में क्या होता है कि आपको फॉर एग्जांपल जुमदा शामश अनन लुकन, ठीक है, गणच करना रजिस्ट्रेशन स्टूडेंट्स को रजिस्ट्रेशन फ्रॉम ऑल ओवर द वर्ल्ड या ऑल ओवर द रीजन. तिमो कर शामस रजिस्टर बट तिम कर शॉर्ट लिस्ट बट जुमदा शामस छ वातान तिम यम सतन सारी क्लास छ खत्म जुमदा शामस छ वातान तिम. दे एक्चुअली बुक होटल्स एंड एवरीथिंग. अच्छा शाम पत के करन तिम काम दे पिच. अगर कौन आइडिया छ मिश आइडिया, शाकर सबश आइडिया, आसिफ सबश आइडिया, तिम छ अतुलान थो तिम छ करन पिच कि ये मेरा आइडिया है, ठीक. और उसके बाद उनको दिया जाता है 1 मिनट. 1 मिनट में उनको बोलना होता है कि आइडिया क्या है, सो दैट दे वांट टू ग्रैब द अटेंशन ऑफ द अदर पीपल. अच्छा, उसके बाद क्या होता है कि जब सारे के सारे पार्टिसिपेंट्स खत्म हो गए जिनको बोलना था, जिनको पिच करना था, then the other participants actually approach them based on their expertise. कि हाँ भाई, अगर कोई किसी को for example कोई startup start करना है, I think Asif साहब should be knowing this because he's actually running a startup, Symcore. तो वहाँ पे you need a person who has legal background, who knows legalities. कौन सी चीज आप बयां कर सकते हो, कौन सी चीज नहीं बयां कर सकते हो. अच्छा, उसके अलावा अगर आप कोई चीज करना चाहते हैं जिसमें आपको एक ऐप बनानी पड़ेगी, सो यू नीड अ पर्सन हु इज एक्चुअली एन ऐप डेवलपर, राइट. अच्छा, उसमें क्या होता है कि सारे लोग इकट्ठे आ गए, तो वो शाम के 5 से लेकर 10 बजे तक फिर से करते हैं. रात के 10 बजे तक, रात के 10 बजे छुट्टी हो जाती है. देन दे स्टार्ट ऑन सैटरडे एंड संडे फ्रॉम 7 AM to 6 PM. 2 दिन काम चलता है. तो इस 2 दिन में वो पूरा अपना बिजनेस मॉडल बनाते हैं. अपना अगर उनके पास कोई प्रोटोटाइप बन सकता है इस टाइम में बनाते हैं. सो उन्होंने क्या किया कि कोविड-19 चैलेंज कर दिया यहाँ पे MIT ने, फाइटिंग हैकिंग कोविड. और उसमें से एक्चुअली आपको इतने सारे लोग मिले जो कि जिनके पास एक्चुअली दे कुड कम अप विद अ रियल एंड एक्चुअल solution with regards to, for example, timo banao ak app ya mazan pata os lagan ki agar es shamas nanyo, for example, ak nafar sab go positive. I'm not talking about community transmission right now. I'm talking about the earlier days of COVID-19 contraction. उसमें क्या हुआ कि आंधा शबीर सब ऐसा समझो यासा उस कोविड पॉजिटिव शामस नन्यो ऐसा कोविड पॉजिटिव, ठीक. मगर दोहस मस कमिस समझो ये आशन फिक्र तरह के मिसाल फॉर एन नॉर्मल पर्सन आक इंसान छु पनिस बथिस लागन लगभग 3 हेड लट दोहस अथ ये छु मगर इंसान फिक्र तरह के बिकॉज़ एवरीवन डज इट अननोइंगली. Why shouldn't you pata kihin emission poor pe yaad kihin ki baki kan nafran samkhos dos. So what they did is that they developed an app jo ki it was connected with your phone, so that it could actually also tell jin do bandon ke paas ya jin bhi do banda bandi jo bhi hai, students, teachers, inke paas agar dono ke paas app installed the, so once they come in contact, you can automatically find out ki nahi कौन सी ऐप जो थी, कौन सा फोन जो था वो क्लोज प्रॉक्सिमिटी में थे. सो एट द एंड ऑफ द डे यू कैन इजीली फिगर आउट कि इस बंदे ने जाने अनजाने में कितने लोगों के साथ इंटरेक्शन किया होगा, सो दैट यू कैन पुट दोज पीपल आल्सो अंडर वॉच. अच्छा, ऐसी चीज एक्चुअली स्टार्ट हो गई थी. शाकर साहब ने नाम लिया था, हमीद साहब का. इनके साथ मैं नाम लेना चाहूंगा. कोविड-19 चैलेंज एक्चुअली किया था NIT श्रीनगर ने टुगेदर विद पब्लिक एंटरप्रेन्योर्स. They had it was led by Professor Saad Parvez from NIT Srinagar, who is also a head of IIED. And then from the industrial side, they actually also talked to Araf Food and also Hamid Saab, who is the CEO of Rahim Motors. And then you also had Dr. Sheikh Fayaz, who came from, who actually has a PhD in innovation from JNU. And he right now works in China. So what they did is that they actually made it, came up with a challenge, and you had a lot of people who actually took part in that. और उसमें एक्चुअली मैंने देखा कि people also made some ventilators, and at the same time they also made a mask which could actually disinfect itself. जब आपने लगाया शाम में आप आ गए तो it had some UV, and then there was also a 60-year-old person, so much respect for him, coming from I think Magam. उन्होंने क्या बनाया था, he was an electronic, he had actually done electronics all through out his life. उन्होंने क्या बनाया था, उन्होंने actually एक self disinfecting station बनाया था. So those kind of things actually you need to bring in. I hope that things are going to actually change from now. अब इसमें ये होगा कि I can say learning from the past and looking at the future. हमने past में क्या सीखा और उसको हमें actually apply करना पड़ेगा. Shahkar साहब यहाँ पे हैं, मैं इनसे गुजारिश करूंगा because I think he's the only person right now who is actually affiliated with a university which also teaches together with Dr. Naveed Shah sahab. What they could do is, जो मैंने यहाँ पे देखा, what they could do is that they can also adapt the syllabus accordingly. जो वो बच्चों को पढ़ाते हैं, जैसे for example management में, flood management, disaster management में, वो उनको there should be an actual case of 2014 floods, right? So आगे जाके अगर pandemics पढ़ाते हैं, endemics पढ़ाते हैं, वहाँ पे COVID-19 as a case study of Kashmir होना चाहिए. And then there should be proper research. So there is a proper need of adapting the syllabi as well. यहाँ पे हमने I was also involved with one project जो यहाँ पे actually हमारे साथ हुआ था. I'm affiliated with Howard Medical School teaching hospital. It's called the Brigham and Women's Hospital. तो वहाँ पे क्या हुआ कि it was not something that, for example, the people at DIC did. They innovated something completely new. But this was need-based. जो यहाँ पे actually हमारे पास एक request आ गई hospital की तरफ से कि हमारे पास face shields नहीं है. जैसे शाकर साहब ने बोला कि DIC also, a person from DIC actually also worked on making those face shields in-house. यहाँ पे भी वही हुआ था. क्योंकि हमारे पास we are actually a 3D bioprinting lab, so we had a lot of 3D printers. And we got a request from some group that we need 3D face shields, 3D printed face shields. और उसमें हमने actually थोड़ा सा काम किया. So those kind of things, we need to actually move a little bit out of our comfort zone. And as DIC is doing for innovations, we also need people who can do research on social sciences, mental health, क्या issue हो गए इस पूरे असना में. And at the same time, I personally believe it's also very imperative that these things can only be brought to fruition when you have a very strong support from the government, right? So government ko actually they should back up such initiatives. They should actually give the people the credit that they need. They should also talk to people who are at the helm and asking them कि कौन सी चीज सही है, कौन सी चीज गलत है. और यहाँ पे भी एक चीज ऐसी हो गई जो मुझे लगता है कि which can easily be adapted to Kashmir also, कि कश्मीर में अभी व्हाट्सएप यूनिवर्सिटी बहुत गर्म है और उस गर्मी को खत्म करने के लिए there should be initiative from the government itself. जैसे शाहकार साहब ने एक्चुअली एक बहुत ही अच्छी चीज भी बताई कि communications, जो आपका यूनिवर्सिटी में communications है, जो आपका यूनिवर्सिटी में information department है, government should take an initiative to work with them closely so that they also bring engineers and scientists on board. ताकि या doctors, medical doctors on board, ताकि लोगों को बताया जाए कि original information क्या है. Because I have seen in the last couple of weeks so many journalists in Kashmir all trying to break the biggest news, which is bullshit. I hope that the good sense prevails, but at the same time, जो already panicked कॉम है, जो already panicked हमारे लोग हैं, students panicked हैं, they should be given a proper and correct information. Thanks a lot.
Thank you, Dr. Shabir Hassan. Yes, exactly. It was heartening to listen to you. And I'm glad you broke the ice. आपने language change की, which we were about to do. हम इस discussion को एक candid discussion बनाना चाहते हैं. Language we had already communicated कि एक mix होगा between English, Urdu and Kashmiri. So we are glad कि आपने language switch करके हमें भी मौका दिया दूसरी language में speak करने का. So I would like to turn to Mr. Asif here. We have not heard from Mr. Asif. Mr. Asif, मैं आपसे ये जानना चाहता हूँ कि आप now you have a startup, you are working, we can call that you are working with the industry. क्या आप हमें briefly बता सकते हैं कि जो आपकी जर्नी रही प्रोडक्ट डिजाइन से प्रोडक्ट डेवलपमेंट तक, जो आइडिया से आपने प्रोडक्ट तक लास्ट कपल ऑफ मंथ्स में, स्पेसिफिकली अबाउट रूहदार जो हम बात करेंगे, जो एक लो कॉस्ट वेंटिलेटर है, तो आप हमें ब्रीफली ले जा सकते हैं उन चैलेंजेस की तरफ जो आपने फेस किए? जैसे शाकर साहब ने अभी बताया कि यू हैड वेल ट्रेन्ड मैन पावर, you had resources to some extent, but we would like to know what challenges did you really face from product idea to the final development of the prototype? Mr. Asif.
First of all, assalamu alaikum everyone.
Walaikum.
It's an absolute honor to be part of this discussion. I'm sorry, is your question regarding the development of Ruhdar?
Yes, specifically Rudar.
All right. So basically, it just happened out of the air. हम कोई आइडिया नहीं था कि वेंटिलेटर पे कभी काम करने का मौका मिलेगा. वेंटिलेटर का तो बस नाम सुना था, तब तक वेंटिलेटर क्या होता है वो तो पता भी नहीं होता था, पता भी नहीं था तब तक कि वेंटिलेटर होता क्या है. सो इस पैंडेमिक, जब पैंडेमिक स्टार्ट हुआ तो बेसिकली हमारा काम ही होता है कि हम एंटरप्रेन्योरशिप में आने के बाद बेसिक आइडिया हमारा ये होता है कि बेसिक ऑब्जेक्टिव ये होता है कि प्रॉब्लम्स अगर कुछ हैं सोसाइटी में, सो वी ट्राई टू टैकल देम, वी ट्राई टू सॉल्व देम. सो वही चीज़ दिमाग में लेके आई स्टार्टेड सर्फिंग अराउंड एंड ये देखना चाहता था कि व्हाट आई कैन कंट्रीब्यूट, किस तरह से मैं कंट्रीब्यूट कर पाऊंगा इसमें. एंड बहुत सारी चीज़ें मैंने देखी इंटरनेट पे, बहुत सारे लोग बहुत सारी चीज़ें कर रहे थे एंड आई वाज अमेज्ड कि इस लेवल पे इतना मतलब हो भी सकता है. सो I started looking directly at the ventilator because this seemed something which was close closely affiliated with my field, electronics field के साथ. So I started looking out कि functionalities क्या होती है, कौन काम कर रहा है, कैसे काम करता है वेंटिलेटर और मैं क्या कर सकता हूँ इसमें. और उसी के पैरेलल में I came to know that हमारे जम्मू कश्मीर में वेंटिलेटर्स की बहुत ज़्यादा शॉर्टेज है. It was like एक रिपोर्ट आई थी कि 97 वेंटिलेटर्स है जम्मू कश्मीर में. उसमें भी आई सॉ कि साउथ कश्मीर में, एंटायर साउथ कश्मीर में देयर आर ओनली 2 वेंटिलेटर्स अवेलेबल, और एंटायर नॉर्थ कश्मीर में देयर आर ओनली 3 वेंटिलेटर्स अवेलेबल. दैट it was I was amazed to know this. I mean I was shocked to know this कि मतलब इतनी भी शॉर्टेज है और वेंटिलेटर was something इतनी क्रूशियल मशीन इस पैंडेमिक के लिए, जो भी हमने उस टाइम पे पढ़ा था कि कितनी क्रूशियल मशीन है ये. तो उस लिहाज से I started directly looking into it. I thought कि बस इसी पे काम करना चाहिए. So उसके बाद I started looking and I came across with the design of MIT. उसका मैंने देखा कि वो क्या काम कर रहे हैं, कैसे काम कर रहे हैं, और उन्होंने तब तक बहुत काफ़ी ज़्यादा काम किया हुआ था इस पे. I started studying कि उन्होंने जो भी स्टडीज रिसर्च वगैरह जो किया था वो सब मैंने स्टडी करना स्टार्ट किया. एंड इन द मीन वाइल मेरे दिमाग में था कि DIC जहाँ पे बेसिकली डिज़ाइन इनोवेशन सेंटर, जहाँ से मेरा करियर स्टार्ट हुआ, एंड दे हैड स्टार्टेड printing these separators, and Javas was working on the splash guards on behalf of Design Innovation Center. So I got in touch with Shoaib sir, and finally got in touch with Dr. Shahkar, and we eventually we started working on this. So coming to the challenge we faced, that's actually the main question you asked. So challenge, there were I think it was full of challenge. I mean nothing was normal. I mean I couldn't have thought to start this project in normal circumstances. और ये तो मतलब अभी pandemic था, lockdown had just started, और इस in conditions में काम करना to work on a product. I mean normal conditions पे जब हम product पे काम करते हैं, there are a lot of challenges. I mean it's a very hectic job. It's a very hectic job to go from the idea and to make it work actually as a product. So in conditions में it was full of challenge. मतलब कुछ normal था ही नहीं इसमें. सबसे पहले we had internet का तो था ही, मतलब lockdown had started, और उससे पहले ही हमारा 4G बंद किया हुआ था, and only 2G was working. So thankfully I had the broadband here, so I could do some research on this. So that was the basic, that was the first challenge we had. And the second was while discussing with the Dr. Shahkar sir and Dr. Shoaib and Shoaib sir, the first, one of the first challenge we faced was of transport. I mean, we all had to, we decided who is going to work on this, but we all had to be in a single place to work on this. So that was impossible at that time, because एक तो ट्रांसपोर्टेशन का इशू था, लॉकडाउन था एंड कर्फ्यू लगा हुआ था, एंड द सेकंड थिंग वाज we couldn't I mean more than 3 people couldn't work in a single place. So one by one we started tackling the problems, and the second, ये तो एक इशू था. दूसरा इशू था हमें फॉर एग्जांपल रॉ मटेरियल जो भी इसमें चाहिए था वो प्रोक्योर करने में बहुत ज्यादा हमें दिक्कत थी, बिकॉज शिपमेंट्स भी बंद हुई थी, लॉजिस्टिक्स का प्रॉब्लम बहुत ज्यादा था, लॉजिस्टिक्स भी बंद हुआ था उस टाइम पे. So these were all the problems that we faced, but eventually alhamdulillah we tackled them one by one, and we had a lot of help from Dr. Shabir sir, and we had a local help from Rahim Motors as well, and a lot of other people जिन्होंने help किया, और we got the material, and we finally were able to finish this product, this low cost ventilator.
Thank you, Asif Saab. So we are a bit short on time. It's really going very well. We would like to spend another an hour for this discussion, but the time is not permitting us. So we will try to ask for concluding remarks, and I will start with Naveed, Dr. Naveed, and I would like him to throw some light. What are the lessons we have learned through this pandemic, and what could we do in the future in this regard? Dr. Naveed.
Thank you. I'm sorry. Actually, I was busy with, I'm in the quarantine center working from here. So we just got the state result. So a lot of patients are outside waiting for discharges because they have been declared negative. So they are all eager to go home. That's why I was a little bit busy with them. So what we have learned, I think, from this epidemic is that, at least in Kashmir, I would like to say that people have to be cooperative. See, whatever is the future course, the lockdown is almost over, but the lessons which we should have learned in the last 2.5 months, the advisories, people are not following it. And I don't think the future is going to be that good, because we are getting a lot of positive patients, and we are expecting, because of the lockdown, non-obeyance of the advisories, people are coming out without precautions. And I hope I'm wrong, but I think that the cases are going to tremendously increase, and God forbid, the number of complicated cases might also increase to a large extent. So what I would like to emphasize everybody that no doubt you are working very hard, you are giving your best in terms of helping in development of infrastructure, but I would like people to obey all whatever is being told to them during the 2.5 months, because lockdown is not an indefinite thing. It had to be put off, and people have to take the advisories, whatever has been mentioned, in order to limit the further progression of the disease, spread of infection, and hopefully we can contain the number of positive patients.
Thank you, Dr. Naveed. I guess we should let you work.
Thank you very much. Thank you. Hope to see you soon again. Hope to see you again soon.
Sure, inshallah. Sure, inshallah.
It was a pleasure for me to be there.
Thanks a lot. Thanks a lot.
Assalamualaikum.
Walaikum salam. Okay, next I would like to talk to Dr. Shahkar Ahmad Nahvi regarding this. So the lockdown started in around mid of May, and it is around mid of June. What I actually have two questions for you. What do you feel could have been done differently? It was not done in the way you thought it should have been done. And my second question is, how should universities, society at large, but how should universities in particular plan for future emergencies. We can have emergencies, crisis in any form. We have a pandemic going on. We may have, God forbid, we may have a war. We may have some another emergency or crisis situation. How do you think universities should plan in that regard?
Okay, as far as your first question is concerned, the lockdown, what could be done differently in lockdown is slightly tricky because
not exactly lockdown, but whatever has been done, say specifically at DIC or in universities, our university, other technical institutes, what do you feel could have been done more or could have been done differently?
See, I basically feel that we have the technical infrastructure in Kashmir at a number of other places. We also have human resources at a number of other places, including NIT Srinagar, Kashmir University. What is basically lacking is character. So if you basically respond to an emergency, why do you respond to an emergency? So to respond to an emergency, to help your people, it requires some degree of courage, some degree of selflessness from your part. And those are character traits that have to be built in from the very beginning within the community. I will just tell you what I felt when I went to IUST for the first time. Right, we started on 30th March. The lockdown was around somewhere in late February. So we went in the university transport, all five of us, including Dr. Majid Kol from NIT Srinagar, Zulkarnain, Shoaib sir, and Asif, and me. So the university had a quarantine center nearby, right? And it was completely desolate. So, and 1 week into the lockdown, nobody was venturing out. It was, the situation is very different now. So it felt like we were encountering death. We were facing death, right? And we had this feeling inside that even if we harm ourselves because of this initiative, we are basically helping our people, right? So I feel what made us do it was more courage, more selflessness towards helping our people. And this was particularly true for the youngsters in the team because the actual initiative was from Asif, from Zulkarnain, from Shoaib. And we elders kind of, they dragged us into it. So we need these kind of people. We need this kind of trait built in the people in the valley, and then we can tackle many challenges because we have the technical know-how, we have the infrastructure to some extent. So this is very important, and this should be kept in mind. What could be done differently was, as Dr. Shabir Hassan said earlier, our research and our teaching should be more practical and pragmatic towards the society in which we are living. We should look around for problems to solve. Publishing good papers in good journals is okay. It's good. You're adding to the knowledge, but there's also a lot that could be done to help people in general, right? So this is again something that should come from within, because you are actually looking for, and let me tell you, Asim and everybody, that this is extremely satisfying because you feel that yes, for the last 30, 20 years, whatever you have learned, your domain knowledge, you're actually using it and you're transferring it to the society and you're trying to help people. Something as simple as a face shield, which is nothing but a stationary thing, item that you just put on your head, and then it helps thousands of people, and those two doctors, right, who are desperate for it. And after that, I'm getting calls from many other doctors. Somebody wants a PAPR to be built. Somebody wants a negative pressure chamber to be built. So I thought I could see that there's scope for so much work, right? So we have the potential, we have the talent. The question is whether we are sensitive enough to the needs of the society, and whether we are ready to sacrifice some of our own personal interests for the gain of the society. That is very important. Unless we are ready to do that, we'll not be able to make any breakthrough in this. So So that could be done differently. We could open our eyes. We could look for problems around. We could try to solve them instead of just searching for problems on Google. We could actually think and train our students to search for problems around them, and there are many of them, especially in the medical infrastructure, medical side. That needs a little bit of training, and the students need to be sensitized towards that. The second question that you asked was how to deal with future emergencies, what to plan. I think we can foresee what could possibly happen in the future to some extent, and develop the necessary technical and human resource for that. But everything is not foreseeable. So to some extent, we may be able to plan. We may be able to equip ourselves to some extent. But in any case, finally, when the problem arrives, the action has to be taken at that point. And the action is not, as I said again, I'm repeating it, it's not just technical, it's also, a lot of the action is human oriented. So what kind of human beings you have around you, that will determine what is going to be the result of your efforts.
Thank you, Dr. Shahkar. So I would again try to go to Dr. Shabir for his concluding remarks. So Dr. Shabir already threw some light in. Basically, he discussed it in detail the research scenario in Kashmir as well as in light of the foreign universities. Apart from research, I would also like to know from Dr. Shabir that regarding the syllabus and the course development, in light of these practical problems, what are his suggestions, some of his suggestions to the university that will better equip us as academicians and our students for future such events?
I think it's a very complex question. I hope to actually finish answering that question within a couple of minutes or so. There are two levels, exactly two levels. One is actually at a local level. जैसे शाकर साहब ने थोड़ा सा उस पे टच किया कि you need to look at local level पे कौन-कौन सी problems हैं. कश्मीर में आए सब problem छन जरूरी कि सास अमेरिका में. ये छन सब problem के. मिसाल ये छ एक problem यस कश्मीर में छ. ये छ नट allergy गसान, ठीक है? Kanshi गसान बिचारस नट allergy. Kanshi गसान यस ये दोदस allergy. Such a it is totally unheard of. कश्मीर में आज दोदस गसान allergy मगर वुन छन में काउन नफर सो वुच में दमान छ बादाम गोश या डून गोश कैसे छ में करान यड़ दुवद वारिया ज्यादा, ठीक है? तो adaptability is a very important thing. अब इसमें आपके बहुत सारे ऐसे डिपार्टमेंट्स हैं जो कि adaptability लोकल या छोटी सी प्रॉब्लम्स को देख के की जा सकती है, और ऐसे कोई बहुत सारे ऐसे फील्ड्स भी हैं जो कि ग्लोबल लेवल पे अडेप्ट कर सकते हैं. फॉर एग्जांपल मैं आपको दे सकता हूं कि बायोटेक्नोलॉजी डिपार्टमेंट, बायोकेमिस्ट्री डिपार्टमेंट कश्मीर यूनिवर्सिटी का पिछले 5-6 साल में बहुत हद तक उसकी शेप बदल गई है. Why? Because they are actually answering questions which affect at a very large level, very large scale. Lekin then you have an example from DIC or IIED or other places, right, wherein they are actually trying to adapt themselves by taking the expertise, by bringing in people together from different walks of life, जो कि एक particular चीज को address कर सकते हैं जो उस time पे मतलब temporarily वो चीज जो है वो चीज बहुत ज्यादा important है उस चीज को address करना. और ये चीज बहुत ज्यादा जरूरी है कि जिस पे मैंने थोड़ी सी पहले बात करी पहले राउंड में कि हम कैसे अडेप्ट कर सके अपने सिलेबस को. अगर हमारे पास 2014 में एक सैलाब आया, उससे हमने क्या चीजें सीखी, क्या हमारा डिजास्टर मैनेजमेंट या मैनेजमेंट स्टडीज ने क्या वो चीज मद्देनजर रखते हुए अपने सिलेबस में थोड़ी सी कोशिश करी कि उसको चेंज करने की. क्या अभी जो DIC ने काम किया, अभी जो बाकी लोगों ने काम किया, क्या उस चीज को इम्प्लीमेंट किया जाएगा एज अ स्टडी टू बी डन इन IUST. लेकिन उसके साथ साथ हमें ये भी देखना है कि आगे जाके कश्मीर में, जम्मू कश्मीर में कौन सी प्रॉब्लम्स हो सकती हैं बिकॉज ऑफ द रीजन. आई एम नॉट टॉकिंग अबाउट द पॉलिटिकल प्रॉब्लम्स, आई एम टॉकिंग अबाउट द हेल्थ प्रॉब्लम्स, हेल्थ इश्यूज, सोसाइटल प्रॉब्लम्स. ठीक, जैसे हमारे पास एक टीम होनी चाहिए थी जो कि फर्स्ट ऑफ ऑल विच शुड आल्सो मेक श्योर कि correct information disseminate हो रही है. We know that we did not have proper internet there. You could not. I saw a lot of people here, a lot of scientists actually made good, informative kashris zabani manz videos. 2-3 minutes. Magar yelna fayde aw ke look hekne chushti because it could not be buffered. Asha when kya sa as banaw so lokut so team local level pe yizan misal as dunihi masters karit MSc chemistry, MSc botany, zoology, biotechnology, biology, MTech karit, MA karit dunihi lad लेकिन बाज़ में तो यू नो सास समझ लोग लाना ये मुझे मास कम से कम मास्टर्स करे उनको हमें एक्चुअली वर्कफोर्स बनाना था ताकि दे कुड एक्चुअली यू नो इनिशिएट एजुकेटिव प्रोग्राम्स एजुकेशन प्रोग्राम्स एजुकेट कर सके लोगों को अच्छे बड़ बार प्रॉब्लम अच्छन अख पन्नस पानस मन से शोर अन के अच्छे वुशन कि ये लॉकडाउन अच्छे डिफरेंट बेस लॉकडाउन खतर ठीक बेस लॉकडाउन में अगर तुम 6 बजे पत नेबर नीरियो तुम हेकु करफला खेत बाजार हेकु गसित यथ लॉकडाउन में बदल चीज यथ लॉकडाउन में छ सु कस क्या यथ लॉकडाउन में बदल चीज यथ मन छ तय यह अख इनविजिबल यस ये अख चीज अख तो फाइनली वो तय मिसाल डॉक्टर साहब पल्मोनोलॉजिस्ट सबसे ज्यादा इफेक्टेड अगर कोई ग्रुप है वो डॉक्टर्स हैं हमें इनका इतना शुक्रगुजार होना चाहिए कि अल्लाह के बाद इनकी अल्लाह की तरफ से दी हुई इनकी एजुकेशन इनकी ट्रेनिंग है जो हमारे काम आती है लेकिन एट द सेम टाइम व्हेन वी नो कि हमारा हेल्थ डिपार्टमेंट कितना डाउन है वहां पे उनके पास फैसिलिटीज बेचारों के पास नहीं है दे आर ट्राइंग देयर लेवल बेस्ट इवन नाउ आई मीन ही इज एक्चुअली participating in this very meeting from a COVID-19 quarantine center. How great of him to be able to at least like get some time and talk to the people here. अब हमें ये भी सोचना है कि at the end of the day अगर हमें कोई प्रॉब्लम हो रही है हम बाहर निकल रहे हैं हम अच्छी जवान कैसे पर मगर मेरा सच नहीं COVID-19 के या शी बदल क्या था शी बदल कलर किया शबाजी अपो नेरे बतो नेबरा बच मैं सिगरेट दम अब दोस्त से बख क्या सा का बकवास करबा he or she is not just putting his or her family members in danger but they are also putting a lot of pressure on people like Dr. Naveed Shah sahab and these people have to actually take the brunt ultimately so wo cheez hame as a society bhi samajhni chahiye that were my 2 cents.
Thanks a lot Dr. Shabir, that was much needed और उम्मीद है कि हम इन चीजों पे अमल करें. So at last I would go to Asif again. Asif, can you hear me?
Yes, I'm here.
Okay. Asif, I would like you to conclude with your remarks and suppose God forbid Allah Taala बचाए कि आगे ऐसी कोई crisis और हम face करें, similar crisis of this scale. हमने देखा है पास्ट में जैसा डॉक्टर शबीर ने भी मेंशन किया कि सैलाब से हम सब गुजर चुके हैं, क्या हालात थे उस वक्त, जो अभी का पैंडेमिक है इससे भी हम गुजर रहे हैं एंड इंशाल्लाह वी विल गेट थ्रू. इन फ्यूचर गॉड फॉरबिड अगर इस स्केल का कोई क्राइसिस या इमरजेंसी हमें फेस करनी पड़ती है, आपके व्यू क्या है, कैसे हमें प्रिपेयर्ड रहना चाहिए इन चीजों के लिए?
Well, the thing about crisis is ये पूछ के नहीं आती है, मतलब we cannot foresee कोई crisis, कोई भी whether it's flood or this pandemic or any war, we cannot foresee it. तो we don't have a clear answer to this कि हमें किस situation के लिए क्या करना चाहिए. So in case of pandemic, अगर pandemic की हम बात करें, ऐसा अगर कोई खुदा न खास्ता ऐसा pandemic आता है, तो we have to see what we did in the past, what went wrong and what went right. For example, अगर हम देखें इस pandemic में universities जैसे जो हम अभी तक discuss कर रहे हैं, universities had educational institutes had a lot to offer, had a lot to contribute. So we have to make them better, and we have to focus on their development. And apart from that, we also have to I'd also like to point out one very important point here is that we had a dire need of manufacturing facilities all over the world, जिन पे pressure आया था, मतलब manufacturing units collapse हो गए, जो कि फिर equipments manufacture नहीं कर पाए, and then small manufacturing groups had to come up, and they had to switch from their local routine to development of these equipments for medical medical personals. So that's the thing. हमें मतलब ये चीज़ है कि एजुकेशन इंस्टीट्यूट्स को हमें ये करना है और मैन्युफैक्चरिंग या इंडस्ट्रीज को लो स्केल इंडस्ट्रीज को हमें एनहांस करना है. एंड वन मोर इम्पोर्टेंट पॉइंट इज देयर इज अ लॉट ऑफ गैप. अगर हम कमिंग टू कश्मीर की बात करें, इन कश्मीर देयर इज अ लॉट ऑफ गैप बिटवीन द एजुकेशन इंस्टीट्यूशंस एंड द इंडस्ट्री. अभी शबीर साहब ने एक बहुत इंपॉर्टेंट पॉइंट कहा कि 30 साल पहले बस पढ़ाई होती थी यूनिवर्सिटीज में, उसके बाद रिसर्च स्टार्ट हुआ. And now we are coming to the innovation start हो रहा है अभी universities में, but we are still far way far from the collaboration between the actual collaboration between the जो research होता है education institutes में and its implementation in the industries. I was amazed to see when जब मैंने MIT का जो ventilator design का जो ये था जो platform, I went through it and मैंने team list check की. I was expecting कि वहाँ पे कोई professors होंगे and वही आसपास के कुछ ये होंगे professors जिनने इस पे काम कर रहे होंगे. But I was amazed to see there was a large group and it was not just the professors from the university. उसमें doctors थे, उसमें industries, उसमें entrepreneurs थे, उसमें सब लोग थे and they were all sharing a common platform and trying to solve the problem. So वो चीज़ अभी यहाँ पे missing है. मतलब it's very much needed also कि वो गैप फिल हो जाए बिटवीन एजुकेशन इंस्टीट्यूशंस मतलब इनोवेशन सेंटर्स एंड इंडस्ट्रीज. वो गैप फिल होनी चाहिए कश्मीर में.
Okay, thank you very much, everyone. I would like Dr. Naveed briefly your concluding remarks. Dr. Naveed, are you connected?
Yeah. Actually, I did the conference. What did you ask? Hello.
Yes, Dr. Naveed, आप सुन रहे हैं?
जी बताएं. मैंने ऐसे सुना नहीं कि it was muted. I was in conversation with the patients.
Briefly, आपके concluding remarks.
अच्छा, मतलब I have concluded in the future, because we have seen the spike of the cases and the number of cases complications. और जो हमने आपके infrastructure बना कर रखा है उसको preserve कीजिए. We might need that in future and please help us disseminate.
I guess Dr. Saab is having some connection issues. Okay, let us conclude then. Naveed.
Sorry, it got disconnected. So my doctors have had enough of the public advisories. We have been continuously advising the public. I think the society, I think they help us to disseminate the information among the masses. I think they will listen to you and help us fighting the pandemic.
Okay, thank you, Dr. Naveed, for being a part of this discussion. I guess your connection was a bit unstable, but what I could get from your message was that we should follow the advisories and we should try to save our lives as well as yes, Dr. Naveed is
in addition to following the advisory, that is
yes, thank you, Dr. Naveed. Thank you for your remarks. Okay, with this, I would like to conclude with this that solitary confinement seldom breeds success. So we have seen that in case of Project Rudar, how a team of different backgrounds got together, had an idea and converted into a product with limited resources, limited manpower, a lot of challenges, and that's actually very inspiring for society at large and all the stakeholders of Islamic University of Science and Technology in particular. So thank you everyone for being a part of this discussion. I hope we will have more fruitful discussions in the future, which is the objective of this Alumni Council. Thank you very much.
Thanks a lot. Thanks a lot. Thanks.
Thank you.